ages 9 to 15, it's quite a crucial time, right? As you move slowly into young adulthood. So again, before sort of the term surgery got tossed around, how did you as a child navigate this part, physically in one way, we talked about it, but also mentally?
As I started to understand the chronicity of what was going on, that like this was not going away, this was going to be something that I had to learn to deal with. That was because those years are so crucial to self-esteem, to autonomy, those types of things. It impacted me really greatly. I felt very different from my friends. I felt as if even teachers and my parents' friends, everybody kind of looked at me as if I was broken, treated me with kid gloves. And, mental health, particularly in children, was not talked about at that time. I remember a time when I was in the hospital again, for those 3 months, I was on total bowel rest on TPN. I was not allowed to eat. I couldn't even have ice chips. And I became very fixated on food because to me, that was the most traumatic part of being in the hospital was that I wasn't allowed to eat anything. They had child life specialists at the hospital. I spent a lot of time in sort of what they called the child life room. There was a stove in there and I would bake. That was like a form of therapy. They helped me bake cookies and cakes and things, and the other patients got to eat them and I did not. I would cut out pictures of food from magazines and glue them or tape them to pieces of construction paper, and they were plastered all over the walls of my hospital room. Once I was discharged from the hospital, I remember going to birthday parties, sleepovers for friends, and having to bring my own special milk. And if pizza was being served, I had to take the cheese off of it. And, those dietary changes were very traumatic as a kid because, again, you just want to fit in. Missing school, never knowing if I was going to feel well enough to participate in whatever it was that was coming up for school, whether it be a field day or a field trip or something like that. Never once at that age were we offered the opportunity to meet with like a child psychologist, which I think is just a travesty. And I'm so glad that that is not the case now. But, so it was kind of me and my own coping mechanisms. And admittedly, they weren't the best. I was a very non-compliant teenager. Often would not take my medicine, and I would do things like hide it in plants and told my parents I had taken it. It was kind of my form of rebellion, but I think also my way of sort of trying to punish my body because it wasn't doing what it was supposed to do. It was kind of a self-destructive type thing. I didn't understand it as that at the time, but looking back and having done therapy as an adult, I very much now recognize that that was part of what was going on.
You were not old enough to understand that it's okay to be angry at your body, but then also not forget that having your body is giving you actually the opportunity to fight back, right? Or to do whatever you can physically to fight this disease. So,
yeah.
Okay. Yeah. So you basically were left to...
I remember.
Right. Yeah.
I was very angry. And it wasn't until I was well into early adulthood. I think I was 19 years old, and that was the first time a healthcare practitioner gave me permission to be angry about what was happening to me and what had happened. And that moment in time, I remember it like it was yesterday. It totally changed the entire trajectory of my life and my way of managing and accepting my disease. Because as a child, I was very much told, you're strong, you can do this. I became everyone else's sort of inspiration porn. Everybody would talk about, oh, she's so strong. And internally, I internalized that, and that became my mantra. I'm strong, I can do this. And because of that, I never made my emotional needs known. Never would talk to my parents about how I was feeling. Never would admit that I was scared. that I was, broken inside and didn't have even the vocabulary at that young age to really name the emotions, just knew that inside of me was like a swirling tempest, but I kept, suppressing it because I was strong. That's what I was told. I was strong. You can do this. You have to fight.